Greetings. Let us talk about botulinum toxin injection, otherwise known as Botox, and its role in GI endoscopy. These are my acknowledgements, and the learning objectives today include about learning the purpose of Botox injection in GI endoscopy and how do you go about preparing the solution and injecting it. Botox relieves the spasm in the muscle. Wherever there is spasm in the muscle, if you inject Botox, it relieves that spasm. If there is spasm in the lower esophageal sphincter, otherwise known as achalasia, if you inject Botox into that sphincter, patients will benefit as the sphincter relaxes. Achalasia patients typically present with difficulty swallowing both solids and liquids, and also with symptoms of regurgitation of fluid as the esophagus gets filled up with fluid. Achalasia is typically treated either with balloon dilation or myotomy, a Heller myotomy by the laparoscopic surgeon, or per-oral endoscopic myotomy by a therapeutic endoscopist. If the patient is not suitable either for dilation or myotomy, somebody who is frail, that patient may benefit from Botox injection. Botox injection results are not do not last for a long period of time. Hence, if the patient is frail and is high risk for surgery or high risk for dilation, then Botox could be an option. Botox could also be used when there is spasm of the pyloric muscle, otherwise known as pyloric spasm, when patients present with nausea, vomiting of stale food, pain after eating, etc. It has also been shown to have benefit in patients with spasm of the sphincter of OD, or otherwise known as sphincter of OD dysfunction. These patients will have pain and sometimes pancreatitis. Although this has been shown to be useful in this condition, this is not routinely used for this nowadays. Lastly, if the patient has pain on defecation, especially severe pain, and there is some blood that comes out at the beginning of the pain episode, when a patient has constipation and trying to move the bowels and they have pain and passage of some bright red blood, you should suspect anal fissure, and that fissure would heal when you relieve the spasm of the internal sphincter muscle with the injection of Botox. So we've learned about the role of Botox in relieving the spasm of the lower esophageal sphincter, otherwise known as achalasia, pyloric sphincter with spasm, sphincter of OD spasm or sphincter of OD dysfunction, or internal anal sphincter spasm secondary to anal fissure. Let us talk about how do you prepare the Botox solution. This is usually done by the nurse, but it is good for us to know that one has to be very gentle when preparing Botox solution. You basically take a 23 gauge needle and a 5 cc syringe, and you draw up 5 ml of 0.9% non-preserved sterile saline solution, and you insert the needle into the syringe and slowly inject the saline solution into the Botox vial. It is important to keep in mind that you have to inject slowly. Otherwise, you will destroy the Botox. Then you disconnect the syringe from the needle and gently mix Botox with the saline by rotating the vial. It's important to be gentle. Do not shake it. If you shake the vial, you will destroy the Botox, and all you will be injecting is saline solution minus the drug. Then attach the new sterile syringe, draw up the reconstituted Botox fluid into the syringe by angling the needle into the bottom corner of the vial so that you extract the drug completely. And then disconnect the syringe from the needle and attach it to the injection catheter. So once you have everything ready, and by this time the endoscopist has already gone into the patient's esophagus with the scope. Usually there will be a lot of froth in the esophagus or liquid material, and he will empty that and he will reach the lower esophageal sphincter and he will be ready for injection. It's important to make sure that everyone, including the patient, has full protection of the eyes, and the rest of the team should have full PPE. Protection of the eyes is important because if there is spillage of the Botox into the eye, it will result in paralysis of that eye muscle resulting in a squint. So important to cover the head of the patient and the eyes with a towel or something so as to protect that patient. So how do we go about injection of lower esophageal sphincter? As you can see here, the lower esophageal sphincter is tight, and you insert the endoscope, you have the needle and primed with Botox, and the endoscopist comes to the lower esophageal sphincter and pushes the needle into the lower esophageal sphincter and starts injecting 25 units into each quadrant. So 25 quadrants, 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock. And after the injection, the needle comes out, and usually very quickly you would notice that the sphincter has relaxed. It's important to keep in mind that patients may complain of some chest pain after the procedure. As the sphincter muscle relaxes, some patients may have acid reflux and may complain of heartburn. So we have talked about the role of Botox in relieving spasm of various segments of the GI tract, starting at the lower esophageal sphincter, pyloric sphincter, sphincter of Oddi, internal anal sphincter, to manage these different conditions. And we also talked about the importance of taking gentle care in preparing the Botox solution. And finally, before we inject, to protect everybody, including the patient, especially those in the eyes. Thank you.